Duke Health is in good faith negotiations with Aetna, and Duke is working hard to ensure that patients continue to have access to care, all the remarkable care that our 31,000 caregivers deliver each and every day to patients across the Triangle. Over the last several years, the cost of care for Duke to deliver it has increased. With appropriate rising salaries for our team members, cost of drugs, supplies, materials, post-pandemic. And unfortunately, Duke has not had a rate increase from Aetna over the last 4 years as those costs of care have increased. So right now, Duke is seeking modest, reasonable increases in reimbursement to cover those costs. We regret that this is causing potential anxiety and hardship for our patients, those that seek care at Duke and want to make sure they have access to our physicians, our care teams, and all that we offer. What we want you to know is that we are working hard every day to try to ensure that continued access. We'd ask you to consider reaching out to Aetna and sharing with them your experience about Duke and how important it is for you to continue to have access so that we make sure Aetna stays at the table with us, working together to find a solution. We work really hard to make sure that patients continue to schedule appointments and receive care they need. And for those that are in the middle of a particularly important episode of treatment, that those patients have continued access to the providers who've been caring for them, even if we go out of network. We call that continuity of care. We've started discussions and we're ready to ensure that all the patients that we believe should qualify for continuity care are known to Aetna so that hopefully they can approve that and that care can continue. For Aetna, please hear, we want to resolve this. As you've heard from us, we want our Aetna members and patients to receive the care they need at Duke. And we're committed to continuing to work with you on a reasonable resolution. For our team, thank you for all that you're doing and for remembering that connection to our why. Duke is unwavering in our commitment to delivering health, hope, and healing to all those who need care at Duke.